I've been looking for a house with no walls or no whispers, no hiding places, no secret sister. Been looking for a house that won't shelter a lie, no tear-stained past or reason to cry. I wanna live in a house of love.
Welcome. This is Empowering Women Everywhere, and I am your host, Nan Gill. And today we have a special guest with us by the name of Dr. FayneFrey. And she's a board-certified dermatologist, and she's going to be talking about skin care, which all of us women want to know about, and what works and what is just a myth. So she's going to explain all about that. She's a graduate of Cornell University Medical School, and she did her internship at Cornell and her residency at Mount Sinai. You want to tell us a little bit about your mission and how you got involved?
Sure. I've been practicing dermatology over 25 years. On a daily basis in my office, I am asked, Dr. Frey, what's a good moisturizer? Or what's a good sunscreen? Or what do I really need? And the women come in and they dump bags of lotions and potions and ointments and gels, and they're confused. Skincare has become exhausting. It's become exhausting for most women. So with my knowledge of biology and chemistry, which I was fortunate enough to study in both college and obviously in medical school, I have become a bit of an expert in the ingredients and skincare formulation, and I'm well suited to help people select products based on what they really need, not based on myth, with all the influences of advertisers and marketing. Exactly.
Yes, exactly.
So with all that in mind, I decided to make it simple for my patients, and I created a website called fryface.com. And the purpose of the website was to help my patients select products that were affordable and that were available and that were well manufactured by manufacturers that hire biochemists and chemists and environmental experts to make fine products, again, that are available to the masses.
Right. That did the job in the best possible manner, but they may not be that expensive.
Exactly.
So on your website, tell us a little bit about the product selection that you have there.
Well, first you have to understand how confusing products are for the average person. When you go to a pharmacy, most people look at the front of the bottle. I prefer to look at the ingredient list, the back of the bottle. When you look at the front of the bottle, you see terms like dermatologist tested, non-comedogenic, meaning it doesn't clog pores. Hypoallergenic means it doesn't cause allergies, or it's intended to be. When the truth is there are no federal standards for any of those terms. So folks are picking product based on a marketing face of the bottle instead of the ingredient listing on the bottle.
And we, as the public, would not know what an ingredient was.
Right, you wouldn't know the exact formulation.
Or what was good for our skin, or what wasn't good for our skin.
When you keep in mind, 80 to 90% of all over-the-counter moisturizers, whether they're eye creams, night creams, firming creams, anti-wrinkle creams, anti-aging creams, I can go on and on and on. They're all formulated very similarly. And when you understand that formulation, you would understand that you don't need a night cream, a day cream, anti-wrinkle cream, a firming cream, a toner, an astringent, an exfoliant, a facial, on and on and on and on. It is exhausting, and it's just not necessary, based on science.
Right. Well, based on science, what do we need?
Well, let's talk about skin for a minute, if we may.
Yep.
Okay. So when most people think of skin, they think of it as a thing of beauty. It's our vanity. But skin has a purpose. Imagine swimming in the ocean, and folks do for an hour at a time. Nothing passes into you. Nothing comes out of you. You are virtually waterproof. You can scrub the dishes after a Thanksgiving meal, and you're at the sink, and you're scrubbing, and there's grease, and there's turkey fat, and you have soap, and you scrub, and you finish scrubbing, and you wipe your hands with a towel, and once again, your hands are just like you left them. You are virtually waterproof. It is very, very difficult for ingredients to penetrate the skin. So if you understand that the skin is really waterproof, and the reason that is the top 15 to 20 layers of skin, and that's all, just the top 15, 20 layers, built like a brick wall. So every cell is a brick, and it's wrapped in mortar. The mortar is fat that the skin makes. And every cell is filled with little proteins that are made from the lower levels of the skin that act as sponges. So if you ask most men, they never moisturize. Yet when you feel their skin, it's quite soft. They don't get brittle and fall apart. The truth is, skin can moisturize itself.
Oh.
And it does that with two mechanisms. That fat that's wrapped in each cell, we'll call that occlusives.
Right.
It keeps water from evaporating into the environment. And the humectants, or the sponges, which suck water from the deeper levels of skin, draws it into the upper levels of skin, and helps retain water. Well, ironically, those are the two things of all the ingredients in skincare products. The overwhelming majority of them act as either humectants or occlusives. So when you look at a formulation of most skincare products,
Right.
it's a water-based product. It has fats in it, it's an oil component, and it has humectants in it. And then there's some ingredients that mix the two. We call them emulsifiers.
Right.
Water and oil don't mix. So your average moisturizer is water-based. It has humectants, or those sponges. It has occlusives, or fats. It has emulsifiers, which keep them together. We might add a little thickener and a little preservative, or else it will go bad. It's water-based. We don't want mold and bacteria. Perhaps a little fragrance. And that is the basic formulation for 80 to 90% of all moisturizers on the market. So understanding that, whether you spend $100 an ounce or $5 an ounce, the basic formula is just that. It's the same that I just described to you.
Right. So you said that you actually decided to make your website because you had some patients that were being troubled with acne.
Well,
and there are some products on the market that actually aggravate.
Yes, there are certain ingredients can actually exacerbate or make certain conditions worse.
Right.
So certain ingredients like isopropyl myristate, it's a synthetic oil. It's used as a skin conditioning agent to make the skin feel soft. Present in a lot of over-the-counter products, can make acne worse. Acetylated lanolin alcohol, another example. I don't expect the average consumer to know these ingredients.
Right.
So what I did on FayneFrey is I created this tool where a consumer can come along and under the product selector, click acne prone. And when they do so, all the products that are showing have been tagged with ingredients where we know, based on science, makes acne worse. It pulls those products out so they don't get those.
Right.
And the same is true for eczema patients. A lot of products have preservatives in them that release formaldehyde. We call them formaldehyde-releasing preservatives. An example would be DM-hydantoin, present in a lot of over-the-counter products.
Right.
An eczema patient would come along and take a moisturizer off the shelf and not realize what they were getting. But on FayneFrey, if you go to the product selector and click eczema prone,
Right.
Many of the ingredients that do release formaldehyde are tagged, and you would not be, the final search would not give you a product that had one of those products that have eczema-causing ingredients in them. Those are also taken out. So that was the impetus behind making FayneFrey.
Right. So basically, it's a tool that anyone can use.
Anyone can use.
They just have to go on to FayneFrey.com.
Correct.
And they can
And click on the product selector.
click on the product selector,
Right.
and then put in their particulars.
Well, it asks you what you're looking for after that. It asks you if you're looking for a moisturizer, a cleanser, or a sunscreen. You would select. And then it asks you what body part, if you want face or body or hand cream.
Right.
And then once products come up, on the left side, you would have preferences. So, for example, for a facial moisturizer, you might select with sunscreen or without sunscreen. So, to me, that's the difference between a day cream and a night cream.
Right.
There's nothing in a night cream that's specific for night. Ingredients don't know what time of day it is. The difference between a day cream and a night cream is the presence or absence of sunscreen. It's a little humorous, but if you worked the night shift, would you have to wear a day cream? No, again, you wouldn't know.
So basically, you can get a day cream and use it at night.
Absolutely, it has no sunscreen because there's no reason to apply sunscreen at night.
Okay.
There are no eye creams. You don't need an eye cream. Anything that you would put here, you would put here. yes, the skin is thin, but if you wouldn't put it here, you shouldn't put it here. So an eye cream is really just, again, formulated like all other moisturizers.
Right.
Water, humectants, occlusives, thickeners, preservatives, fragrance.
Right.
Those are eye creams. And so on the site, on FayneFrey, you won't see an eye cream. You will see for the face or for the body.
Right.
And then you can select with sunscreen, without. You can select fragrance-free, which I always recommend because the #1 cause of reactions to all skincare products is fragrance. So I always suggest selecting fragrance-free. And then on the bottom it says My Skin Conditions. Acne-prone, eczema-prone. And by clicking either of those, you would eliminate products that had ingredients in them that would make those conditions worse.
Right.
And you also have the option, and it's totally personal preference, if you would prefer a tube or a pump. Some people travel, they don't like a pump. Others like the jar, and you would have a preference of dispenser type.
Right. So you've actually selected a few different products, and you
Hundreds.
have no association with any of them.
Correct. I have no association with any particular manufacturer. I do not sell anything. I don't plan on selling anything. It was truly a tool to help my patients select product that was available to them.
Right. And now
Everywhere.
everyone can actually benefit from
I
what
hope
you
they do.
set up.
I hope they do.
Now, there's a lot of people claim about anti-aging. Is there any substantial difference between an anti-aging cream and a regular cream?
The anti-aging skincare market is millions and millions, maybe even billions. Like all other moisturizers, anti-aging creams are moisturizers. Science has yet to figure out a single ingredient or a single product that reverses or slows the aging process. As silly as this sounds, the only way to not age is to die. We're all aging. There is no particular
Doesn't the
ingredient.
sun actually make you age quicker?
Yes, well, there are two kinds of aging. To understand aging, anti-aging, you have to understand aging. Aging is defined as a gradual decrease in physiological function that occurs in every mature member of a species, so it occurs after adolescence, and it's irreversible. That's the definition of aging.
Right.
Anti-aging implies it stops that process. That doesn't exist. But skin aging, there are two types of what we call skin aging. One is called intrinsic aging, which is just as we get older, physiologic function decreases, whether it's genetic,
Right.
and you follow family patterns.
Right.
The second type of aging is called extrinsic aging, and this we have some control over. And you mentioned the sun.
Right.
The sun does cause changes in the skin. Probably 80 to 90% of the changes we see, the pigmentation, the coarse wrinkling, is from the sun. And if anyone would compare the skin on their private areas, either on their breast or on their buttocks, and compare that skin to the skin on their chest,
Right.
you would see that skin is the same age, but the changes on the chest where the sun has been exposed
Right.
is very, very different than the skin in the unexposed areas.
I'm starting to realize that now.
Yes. So anti-aging is really a marketing term.
Right.
There's no standard definition of anti-aging. And with all that being said, there is a magic potion, and it's based on science. So Dr. Adele Green from Australia did the studies, followed 900 women, or 900 individuals, and they're all necessarily women, for 4.5 years. Half of them were given this product. The other half were not told to use it or not. In 4.5 years, they then looked at the skin and looked at the aging differences. There was a 25% difference in aging with the group that didn't use the product compared to those who did. The product is everywhere, yet only 1 in 10 Americans really use it every single day. And you mentioned the product. It is, do you know what the product is that I'm talking about?
Sunscreen?
Sunscreen.
Oh, okay.
It is the most biologically active anti-aging product on the market today.
Right.
And if you're going to spend any money on skincare,
Right.
I tell people what you really need on a daily basis, moisturizer with sunscreen.
Right. Now, what does SPF mean? I hear that all the
SPF
time.
means sun protection factor.
Mhm.
On the top of FayneFrey, there's a blue bar. If you clicked on Sun Facts, you can get answers these
Right.
types of questions. So if an individual goes into the sun, a fair-skinned individual like yourself or myself, we might burn in about 20 minutes. An SPF of 2 would mean it would take twice as long for us to burn, so that would take us 40 minutes.
Oh,
An SPF of 3, it would take us 3 times as long to burn, or it would take an hour. So an SPF of 15 would take us 5 hours to take you 5 hours to burn.
Right.
That protects against 93% of all UVB or sun burning rays.
okay.
SPF 15. SPF 30 protects you against 97% of the rays. So that's what the American Academy
SPF what?
30.
30. Okay.
Right. So SPF 30 protects 97% of ultraviolet B rays, and that's what the American Academy of Dermatology now recommends, an SPF of 30.
Of 30.
On FryFace, you will not find a sunscreen or a moisturizer with sunscreen that has less than SPF 30 in it, so you need not worry.
Do you know what are some of the skin myths that we all are all suffering under that are really
Yes.
something that you want to?
Right. Yeah.
Bring to
The
the surface.
skincare industry is well intentioned. The manufacturers happen to make very good moisturizers. And it's good to moisturize because if you take a raisin as we get older and you pump water into it, you get a grape. And
Right.
that does make our skin look better and feel better.
Exactly. So anti-aging is moisturizing with sunblock.
Exactly. You just summed it up. And so the myths are abound. And a lot of individuals in the skincare industry, they mean well, they hear something, it sounds good, but science should be based on double-blinded control studies, not on anecdotes.
Right.
So you'll hear a lot of things. I call it snake oil. For example, when we were kids, we used to run around and say, don't cross your eyes, they'll get stuck like that.
Right.
Now, I don't know about you, but I've never run into anyone whose eyes were crossed because they were stuck like that. Have you?
And I don't know how to cross my eyes.
Okay. Well, that's snake oil. In the skin industry, again, somebody said that, and it sticks. There are several myths. One myth is if you spend more money on skincare products, it's
Right.
better than spending inexpensive products. And I told you, the basic formula for all these moisturizers is similar.
And you
One-
demyth it all on your website.
Yes,
so
on my
we
blog.
can
There's a
find that.
FryFace blog that
Right.
demyths a lot of this.
Right.
Some skincare products are sold based on age. For mature skin, the ingredients don't know how old you are. Whether propylene glycol is being put on a 50-year-old face or a 30-year-old face, I promise that ingredient does not know the age of the skin. Okay, so a big myth is skincare sold for mature skin.
Right.
Another big myth, which comes up frequently, is take your makeup off before you go to bed at night or you'll get wrinkles. Now, I've never seen a double-blinded control study. I'm not saying not to wash your face,
Right.
because you're going to get a dirty pillowcase is what you're going to get.
Right.
But there's no evidence you're going to get wrinkles.
Yeah.
I had a battle on Twitter recently with a company that was touting to sleep on your back, because if you sleep on your back, they surmised you wouldn't get wrinkles. Now, the only study I know of is a plastic surgeon in the Midwest who asked 100 women how they slept and then evaluated them for wrinkles and found there was no correlation between how they slept and wrinkles. Ironically, this company was selling a pillow that kept your head erect and straight.
Yeah.
So oftentimes when people make these claims, they're selling something. The silk pillowcase is another one. Whether you sleep on a pillow like this on cotton or like this on silk, if I'm selling a silk pillowcase, it might be compelling for me to tell you to use silk.
Right.
But there's no double-blinded control study that shows silk pillowcases are good for you. I can tell you what is good for you if you want to hear it.
Yes, please do.
Okay. There are no shortcuts to good skin. It's more difficult than people think. 6 things people need for quality skin. 1 is exercise. Research shows over and over that exercise is really good for your skin. There was a study that showed older folks, when they exercised, the thickness of the skin actually increased.
Okay.
As we get older, skin thins. So exercise we know is good. Sleep. Get those 7-8 hours at night. There's a reason we call it beauty rest. Right?
Yeah.
3, eat a healthy diet. You can put all the antioxidants on the surface of the skin. We have a physiologic problem. It might help at the surface, but all the damage for the sun is occurring way down deep in the dermis.
Right.
I told you, you are impermeable. Things don't get into your skin so well, which is why
Right.
you can swim for hours in an ocean. Those antioxidants are not penetrating all those layers of skin
Right.
to where the damage is really being done, or there's no good, compelling, double-blinded studies to show that.
Okay, so what
So-
foods are good for antioxidants?
Colorful foods, fruits, vegetables, lean meats, healthy foods.
Okay.
That's the third. The fourth is a moisturizer. Take those raisins, pump water into them, make grapes. It's firmer, it's nice. Yes, it's a temporary water pump, but it will optimize how your skin looks.
Right.
The most potent biologically active anti-aging preventative we spoke about is sunscreen.
Right.
Every day. Right now, I got up, I brushed my teeth, I put on a moisturizer with SPF 30. It's a habit. I put it on my face, my chest, and the back of my hands.
Mhm.
Don't forget your hands. And the sixth ingredient for healthy skin, and more research is showing it, is laughter. Laugh. For whatever reason, whether the stress levels are going down, whether endorphins levels are going up, but more and more research is showing laughter is truly bringing beauty to the skin.
Well, that's perfect. We can all just have a good
Yes,
time.
have a good time.
Not
So-
stress. Don't
Not
stress.
but don't spend money. The industry. It's a safe industry. It makes some wonderful moisturizing products, but the money that is spent, again, ounces for $100, $160. That's $2,500 a pound.
Yeah.
There is no perishable that's worth that kind of money.
Plus, if you get a healthy diet, exercise, and laugh, you'll do more good for your skin.
You will, and be a happier person to boot.
That's it. That's
Yes.
it. Good. So, as far as your counseling for some of
Yes.
your patients, you're working with some youth right now.
I try to speak to a lot of the young patients who come in and ask me these questions. What I find is, unfortunately, whether it's our culture, whether the industry is taking advantage of our insecurities, women are being defined by their physical beauty. Physical beauty fades. I don't mean to be negative. I think it's wonderful to look nice. But true beauty is not physical beauty, it's character. Because as your physical beauty fades, you can maintain your character. And I have daughters, and hopefully one day I'll be blessed with granddaughters. When they walk by a mirror, I don't want them to say, I wish I wish I was taller, or I wish my hips were smaller. I wish they would say, did I make someone laugh today? Or did I give to charity? Or did I open a door for somebody? I wish they would emphasize the character in themselves and not so much their physicality. And so counseling young girls, again, I will help anyone look as best they can, but I don't think physical beauty should define women. And unfortunately, that's the case all too often.
What do we really need as far as the procedure we should take as women, to care for our skin?
Again, the skincare industry has gone mad. You don't need exfoliants, scrubs, anything that removes those top 15, 20 layers. Those layers that keep you well moisturized is not necessarily good for you, nor is there any science that shows it's beneficial. It may feel good, but it's not necessarily healthy for your skin.
So they talk about exfoliating your skin, and you don't see any scientific...
No. The best exfoliant is your skin itself. It's constantly sloughing. If the skin is well moisturized, the dead layers will fall off on their own, and it will be very moist. Now, it might feel good to exfoliate, but again, you are taking those 15 to 20 layers, the ones responsible for maintaining moisture,
Right.
you're taking them off. You need them. It's the same thing harsh soap does. Harsh soap will dry you out for the same reason.
Right.
Soap can't distinguish between the lipids and those humectants that you need from the dirt that you don't want.
Right.
It strips it all. So a mild cleanser is what we use. So I tell my patients, keep it simple. Get good nights of sleep, eat when you get up in the morning, wash your face with a mild soap-free cleanser, apply a moisturizer with SPF 30 or higher.
Right.
That's what you need.
Right.
That's all you need.
Now, on your body, they have scrubs and everything for your
Same
body?
thing. Don't eat scrubs. After you come out of the shower,
Right.
you have a thin layer of water on the surface. That's the best time to apply a moisturizer that has that occlusive, that locks in the water. And I would suggest everybody does that at least when they get out of the shower.
Right.
And in the winter, when the air is very dry and water wants to fly out of your skin into the air,
Right.
perhaps you might want to do it twice a day, in the morning and in the evening, again, to keep the skin moisturized.
Right.
But very simple. A good, healthy skincare regimen is moisturizer with sunscreen every day. You can moisturize in the evening again without sunscreen. That's my definition of a night cream, is a
Right.
moisturizer without sunscreen. A lot of it is personal preference. Cleansing, there is no consensus on how often an adult woman with healthy skin should cleanse. I rarely put soap on my face. I use water in the shower. Some people like to actually wash with soap. There's no consensus in an adult woman. Not true for adolescents with acne. Adolescents with acne, there is evidence where washing this face with mild cleanser twice a day is beneficial because they have a skin condition.
Right.
That's not the case. So to cleanse every day, there's nothing wrong with it if you can handle that. Moisturize with sunscreen every day and follow those other 3 essential, no shortcut habits to healthy skin. Eating well, exercise, and sleeping.
Now, you touched on acne. What causes acne?
Acne is a hormonally sensitive skin condition, which is why we see it primarily in adolescents, where you have a little microinflammation and a little overstimulation of the glands underneath the skin.
Right.
And when these glands are trying to, they're overproducing, and so they create a clog, or they create a plug. And that's how acne begins, as these micro plugs. And then behind the plug, we get secondary infection with bacteria that lives on the skin.
Mm-hmm.
So we have an inflammatory component, and we have a bacterial or infectious component.
Right.
And I don't recommend treating acne on your own. It is a true skin condition. It can lead to scarring. And so I tell my patients and their families, if you have acne, see a dermatologist.
And you have this amazing tool that everyone can use, which is your website. Do you want to tell us the address of your website?
Sure, thank you. Fryface.com. It's FRYFACE.com. You would hit on the product selector to help yourself select product, or the blog to get information and about skin and how skin functions.
And you have a lot more things that you offer on your website that all about the skin and about anti-aging and about
Yes.
skin blocks and skin screens and everything.
Moisturizers,
like
what they are, the anatomy of skin, how skin does keep yourself moist. So it's there's a lot of information for somebody who's curious and wants to know more.
Okay. So thank you very much.
Thank you for having me. It has been my honor.
It's been a pleasure. And
Thank you.
this is the best job I could ever have because I meet such wonderful people and I learn so much about everything.
It's wonderful.
And I've really learned a lot about skincare because I know so many people think that it's the outer way that you look and that's the important thing, and that if you get this skin product or that skin product, you're going to have a better life or a happier life, and really it comes from inside.
Absolutely.
So
Well said.
Yeah, thank you so much.
Thank you for having me. Thank you very much.
I've been looking